Hey everyone, this is Dr. Neal. Today I'd like to talk about the misconceptions, diagnostic confusion, and treatment of cystic acne. To understand the current medical standards of care, it oftentimes helps to know the history. Decades ago, when many pharmaceutical companies and doctors were searching for weapons to treat the skin with, acne was classified into three basic categories: mild, moderate, and severe. And cysts and nodules were lumped into the severe category, eventually to be called nodular cystic acne. The reality is that cystic acne is just plain old acne. It's just a little bigger and a little deeper. It's not a different disease and it's not a different condition. It's the same condition at a higher level on the grayscale. It is also true that any treatment specifically targeting cystic acne will also be one of the treatments for regular acne. And so with all the overlap, there's really no reason to classify cystic acne as cystic acne. It's just acne. Anyone that's had acne for several decades knows that small bumps and cysts can crop up in any location at will when you're not in total control. The way I would phrase it would be like this. A patient is having cysts while their acne situation as a whole is not in control. And these cysts are just one of the many manifestations of acne. Of course, they are deeper, more painful, certainly induce more fear, and much more prone to scarring, which creates a much higher sense of urgency in this situation. But this situation is still plain old acne. It's just a little more urgent in the grayscale of minimal to severe acne. When you have cysts, it's certainly time to act. Allow me to offer up an analogy that may clear up any of this semantic confusion. In our culture, we have many words and diagnostic classifications for those patients who are overweight. We have slightly overweight, obese, morbidly obese, and super obese, and many other colloquial terms used in the culture to describe being overweight. So the question is, are these terms really different conditions or just a grayscale of the same condition? That's the question that comes up when you think about, quote, cystic acne. It's the grayscale of acne. You have minimal small blackheads and some plugged pores, then you have a violaceous, volatile, inflammatory process we call severe cystic acne. But the whole thing is just acne. And when you think of it on the grayscale like that, you understand there's no special classifications. Similar to the analogy of morbid obesity, when someone has a severe case of any condition or is on the far end of any condition, there's a time sensitivity because consequences come quicker. Someone who is morbidly obese, they will have a heart attack or a stroke quicker than someone else who is just a little bit overweight. And the same is true for acne. Someone who is having a heavy case of cystic acne will scar themselves quicker than someone who's having some mild little mini bumps. I hope this analogy by itself clears up all the semantic confusion regarding acne versus cystic acne. It's all the same. And it is all treatable without oral medications, as proven by the severe case playlist on the homepage of the site. Now, here's the interesting part of this conversation. If a patient is suffering from deep lumps and bumps due to their acne condition, why do you think they prefer to call it cystic acne than just plain old acne? Think about it. This is the interesting psychological question. Why are people emailing me saying, Dr. Neal, I don't really have acne, but I have cystic acne? Or, Dr. Neal, I have a special case of cystic acne, can you help me? Why do you think people prefer the term cystic acne to just acne? Think about it. Here's why. It's an emotional coping mechanism used to deal with the heartache and failure of prior acne treatments that were intended to treat plain old acne. It also deflects from the stigma that is associated with plain old acne. There is also a third subconscious reason why people prefer this term. By getting a specific medical diagnosis that seems more unique or more rare or more difficult, it allows many people to see it as too large of a hurdle to even tackle and gives them an avenue to find hopelessness. Now, you might ask, why would someone be subconsciously searching for hopelessness? And here's the answer. Hopelessness and acceptance with difficult medical conditions is sometimes emotionally easier than the tenacious pursuit and battle of a stubborn chronic inflammatory ailment. So, many people will either unconsciously or consciously choose to accept their condition rather than to fight it. It's almost as if they need a vacation from the fight or respite care. That's what it's like having a chronic condition. Sometimes you just need a reason to take a break and let it just manifest. And while that is understandable, because that's the human nature, is to not have to work so hard for your chronic ailments, this acceptance of severe inflammatory processes in the body is always a regrettable mistake, only because there is a concept of wear and tear and time sensitivity and permanent scarring. So when this happens, it's always regrettable, it's always a mistake, and what this patient needed was either a better approach, a better coach, or say a better avenue to find hope without having to spend so much time and energy to achieve their results. Or maybe they just needed some improvement in the first few days or the first few weeks so they didn't have to hope and wait because maybe they've had enough of being patient. I'd like to do a demonstration for you guys today and see if you can feel the emotional phenomenon that I've been witnessing for years. I'll act it out for you, and you tell me if you can feel the subconscious and unconscious emotional process that's going on during this impression. Let's imagine two people. One person who's suffering from acne, and the other person who's their friend, or their acquaintance, or their coworker. Conversation could go like this. Hey, is that acne on your face? No. No, it's what doctors call cystic acne. It's much different, much tougher, much different. Another example. Oh, you still get acne, huh? Even if it's compassion. Oh, you still get acne, huh? No. This is what is called hormonal acne. It's much different, much tougher to treat, definitely not the same. Huh, are you still getting acne? No. My family just has something special called genetic acne. It's much different than plain old acne. What's that on your face? Oh, don't worry. It's a special condition called adult acne, and it's really has nothing to do with regular acne. It's called adult acne. I have unique acne. I have resistant acne. My skin is allergic to all acne medications. I have nodulocystic acne. Oh yeah? I have severe nodulocystic acne. Oh yeah? Well, I have a hormonal imbalance that is undetectable by blood work, and it is causing my acne. No, acne treatment won't work for me. I have polycystic ovarian syndrome, and my acne is directly related to that, and nothing can touch it. When I do these demonstrations, can you hear and feel the emotional coping that is going on within a patient when this occurs? Can you hear the denial of plain old acne? I hope this demonstration showed you what I've been witnessing for the last decade. So let's further investigate. Why don't we want to have plain old acne? What are we running from? Here's why. It's the stigma associated with plain old acne. There is a historical and cultural stigma that says that acne patients are oftentimes unhygienic, eating poorly, not taking care of themselves, doing crystal meth, doing all types of drugs, taking anabolic steroids, not conscious of their body, not conscious of their mind, not intelligent, and not really caring about how they look or how they feel as far as wellness. Now, from all the acne patients I've met, and including myself, this couldn't be further from the truth. Acne patients are incredibly motivated and incredibly goal-oriented when it comes to getting well and trying to fix their skin and their body and their life. So you can see, as an emotional coping mechanism, no one who is highly motivated wants to be lumped in with a stigmatizing diagnosis like plain old acne if anyone is going to believe that by having that diagnosis they are in any way lazy, unmotivated, or unhygienic. It's unacceptable. And thus, a new, more specific diagnosis comes into play. It's purely emotional. From a scientific standpoint, it's all acne. From an emotional standpoint, it's hormonal, cystic, adult, genetic, teenage, female, male, whatever label you want to put on it, whatever protects you from being plain old acne, that's what's going on emotionally. So, here's the lesson for today. Plain old acne, the same kind of acne that was seen in the 1950s and 60s and 70s and 80s, is a very stubborn chronic condition. It has shown, plain old acne has shown, to be resistant to many medications, resistant to many lifestyle changes, and is driving millions of people crazy who are highly motivated to get better. In this practice, we call it, quote, plain old acne, to break the stigma and to recognize that all cases can be very powerful and we never underestimate its power. It needs no other self-victimizing name, as we can see from the video gallery that it's always treatable. And we recognize that any stigma that is associated with it is oftentimes inaccurate and ignorant.